Community nutrition is a modern and the comprehensive profession that includes nutrition, dietetics, nutrition education, and the medical nutrition therapy, but is not limited to public health. Community nutrition deal with a variety of food, nutrition of food, and nutrition. Issues related to individuals, families, and special rules that have a common link, such as place of residence, language, culture, or health issues. There is an increasing need to focus on the community in health promotion and diseases prevention because behavior is highly influenced by the environment in which people live. Local values, norms, and behavior pattern have a significant effect on the shaping on individual is altitude and behaviors. Establishing an overall effective community nutrition practice involves correctly using and the combining each part. The increasing movements towards using a community approach requires community nutrition to become more visible and vocal leaders of community health. Before community nutritionists can participate in nutrition and healthcare planning, they must be knowledge about the concept of community as client. Community nutrition, an area of nutrition that addresses the entire range of food and nutrition issues related to preventing diseases and improving the health of individuals, family, and the community. We have the personal prevention, then the community based prevention, then the system based prevention. Personal involves people at the individual level, for instance, educating and supporting a breastfeeding mother to promote the health for her infant. Community helps target people, example, public campaigns for the low diets to decrease the incidence of obesity and or the heart diseases. System-based prevention. It deals with the chaining police and laws in order to achieve the objective of the prevention practice. Example, laws regarding childhood immunization, food labels, food safety, and sanitation. Nutritional problems in India. We have the protein energy malnutrition, then the deficiency of vitamin A, then the anemia and iodine disorders. This chapter is focused on undernourished. Cause of malnutrition, poverty, illiteracy, unawareness, and the carelessness towards personal care, especially in children, adolescents, girls, and the women. Nutrition can be divided into three stages. It is a poor nutrition. Cause of malnutrition is the poverty, illiteracy, or the unawareness. Nutrition can be divided into three stages: poor, under, or over. According to the estimates of World Bank's, India ranks second in the world of children suffering from the malnutrition. According to World Bank, 27 to 28% of all the underweight children belong to scheduled tribes have the poorest nutritional status and the highest wasting. Determinants of malnutrition, maternal malnutrition, low birth weight, faulty child feeding practices, dietary inadequacy, frequent infections, large families, high female illiteracy, taboos, and the superstitions are the main determinants of malnutrition. Factors affecting nutritional problems are the high risk group. It is the pregnant and the lactating women, infants, preschool children. 75% suffer from anemia. 57% have vitamin A deficiency. Adolescents, girls, elderly, and the socially deprived people. Other than the above high risk group, following statistics show that India is the country with the largest population of diabetic. 11% Indians are the overnourished, 30 million people suffering from diabetes. It's according to 1985 census. And then the by year 2010, India is projected to have 50.8 million diabetic patients. Protein energy malnutrition refers to the deficiency of energy and protein in the body. It's 1 to 2% of preschool children in India suffer from the PEM. Reason of PEM is the main is inadequate intake of food both in quantity and quality. Inadequate intake of food leads to infections, that is diarrhea, respiratory infections, measles, and the intestinal worms. Contributing factors to PAM are the factors involved into PAM are poor socioeconomical condition, large family size, poor maternal health, failure of lactation, premature termination of breastfeeding, adverse cultural practices related to child rearing and weaning, delayed supplementary feeding. Clinical forms of PEM are the marasmus and the kwashiorkor. Marasmus is a common form of PEM that occurs mainly in infants because of the deficiency of protein and calories characterized by the extreme wasting of the muscle and the don't expression. Symptoms include loss of body fat, muscles, tissues, fold of skin over gludi and axilla, brittle hair, hypothermia, absence of edema or puffy or swollen appearance of legs and arms, slow pulse rate, and slow breathing rate. Kwashiorkor occurs in children between 2 to 3 years of age. It is an acute form of PEM due to deficiency of protein in the diet, both in quantity and the quality. Micronutrients, iron, folic acid, iodine, selenium, and vitamin C of antioxidants, albumin, swelling or puffiness of the tissue directly under your skin, especially in legs or arms. Vitamin E, PUFA, glutathione directly under your skin, especially in legs or arms. Vitamin E, PUFA, glutathione is identified as a swelling of the belly, which is deceiving to their actual nutritional status. Malnourished child with the PT edemas, growth failure, moon face, distended abdomen, ascetic, a large river with the fatty infiltrates, thinning of the hair, loss of teeth, skin depigmentation, dermatitis, irritability, anorexia. Assessment of PEM: weight for age, it is weight of child upon weight of a normal child of same age. Of same age. Okay. And their preventive measures are the health promotion measures of breastfeeding, low cost weaning food, nutrition education, immunization, food fortification, early diagnosis and treatment rehabilitation. Low birth weight, maximum birth weight is less than 2500 grams. 30% of the babies born in India are LBW, that is the low birth weight. Causative factors: many factors are maternal malnutrition and anemia, illness and the infections during pregnancy, high priority, no interval between two deliveries. It is LBW. 2500 gram, 35% of babies are the LW. In India, causative factor: main factors are the maternal malnutrition and anemia, illness and the infections during pregnancy, high priority, no interval between two deliveries. Factors modifying prevalence of the LBW are the more institutional deliveries, improving number of the ANCs, improving quality of ANC includes number of ANCs, TT, weight, BP, examination of blood, examination of urine. Xerophthalmia is a dry eye. It is a disease that occurs due to lack of vitamin A, also called the xeroma, which means an absence of tears. It is most common in children aged 1 to 3 years, in which cornea and the conjunctiva become cornea and the necrosis. Bitoid spot is a collection of dried epithelium, microorganisms, etc. form shiny grayish white spot on the cornea, also a sign of lack of vitamin A. Then the keratomalacia. Ulceration and softening of the cornea due to lack of vitamin A. Risk factors are the ignorance, faulty feeding practices, infections, diarrhea, use of skimmed milk to be devoid of the vitamin A. Prevention: this can be prevented by oral administration of large doses of vitamin A, retinol, palmitate, medium term action, food fortification with vitamin A, the consumption of vitamin A, dish foods such as liver, beef, chicken, eggs, fortified milk, carrots, mangoes, sweet potatoes, and leafy green vegetables. Promote immunization to infections. Then the nutritional anemia. Hemoglobin is one of the main component of RBCs which help in the binding of oxygen. Lack of hemoglobin occur as a result of deficiency of iron in diet which causes nutritional anemia. Anemia in females in India. Pregnant women, adolescent girls. Reason of iron deficiency anemia is the inadequate intake of iron, poor bioavailability, poor cooking method, only less than 5% is absorbed, excessive loss of iron, that is menstruation, rapid pregnancies, hookworm infestations, other illness. Effects of anemia are the increase the risk of maternal and the fetal mortality and the morbidity, and also increase susceptibility of infection due to impaired cellular response and immune function, reduction of the work performance and productivity. By providing iron and folic acid supplementation, nutrition anemia prophylaxis program, daily iron and the folic acid supplementation to pregnant women, lactating mothers, and the children under 12 years. Fortification of salt with the iron, control of parasite, and nutritional education. IDD, iron deficiency disorders. They are a spectrum of the disabling condition arising from an inadequate dietary intake of iodine. It affects the health of humans from fetal stage to adulthood. Lack of iodine intake, consuming foods with low iodine content, crops which are grown in iodine depleted soil, increase demand for iodine in the body. Demand of iodine is increased during the stage of rapid growth. Demand exceeds supply, results in deficiency. Presence of goitrogens, goiter producing substances naturally present in some foods, cabbage, cauliflower, etc., interfere with the iodine utilization. Then the endemic goiter is also called the Derbyshire neck, enlargement of thyroid gland causing swelling in front part of the neck due to lack of iodine in the diet. Goiter belt, that is the Himalaya region, graded from 0 to 4, common among girls and boys. Endemic goiter. Then the cretinism, it is a severe form of IDD which occurs during a fetal stage as a result of interference with brain development. Cretinism causes brain damage and results in death. Other causes include growth failure, MR, speech and hearing defects. Fluorosis is a result of an intake of excessive amount of fluorine to drinking water. It is classified into two types, that is the dental and the skeletal fluorosis. थक गया पानिया नु पुन पुन के. Dental fluorosis can be seen in children, that is 5 to 7 years of the age. Their teeth lose their shiny appearance and chalk white patches develop on the teeth. These changes are called the mottling of the enamel. In severe cases, loss of enamel gives teeth a corroded appearance. Dental fluorosis is confined to permanent teeth and develops only during the period of formation. Skeletal fluorosis is a bone disease caused by excessive accumulation of fluoride in the bones. Skeletal fluorosis is seen in older adults. Heavy fluoride deposition on the skeleton manifested as pain, numbness of the tingling sensation of the extremities, stiffness of the neck of a formal of the skeletal deformity associated with the fluidize. The lower limb appears as knock-kneed due to the osteoporosis. Prevention of fluorosis. It is a key to drinking water's fluorine level below the 1 milligram per liter. Deep fluoridation of water using Nalgonda technique. This technique involves addition of aluminium salts lime and bleaching powder followed by rapid mixing, flocculation, sedimentation, filtration. Other prevention is use of fluoride toothpaste in areas of endemic fluorosis. Letharism or the neuroletharism is a neurological disease of humans and domestic animals caused by eating certain legumes or genus Letharus. Letharus sativus casei dhal in the human is referred as neuroletharism. It contains a toxic called beta oxalyl aminoalanine. Letharus casei dhal is good source of protein. It's relatively cheaper. The disease prevents as the crippling disease of nervous system, characterized by the gradually developing spastic paralysis of the lower limbs. Steeping muscle pulses are soaked in hot water for about 2 hours and then soaked water is drained off completely. The crops which have low toxin varieties of the Lathyrus are banned according to Prevention Food of Adulteration Act in India. Obesity, that is the most prevalent form of the malnutrition, abnormal growth of the adipose tissue due to the enlargement of fat cells, hypertrophic increase in number of the fat cells, hyperplastic, or combination of both obesity, hypertrophic, enlargement of fat cells. थक गई पानियां बूंद बूंद के. Body fat, that it might have a negative effect on their health. If a person's body weight is at least 20% higher than it should be, he or she is considered obese. Obesity is a complex condition with biological, genetic, behavioral, social, cultural, and environmental influences. Age, sex, genetic factor, physical inactivity, socio-economic status, eating habits, psychosocial factors, and alcohol. The direct cause of overweight in India is lack of physical activity due to sedentary lifestyle, loss of traditional diet, faulty diet, high stress, and high rate of economic growth. BMI is the body mass index is a person's weight in kilograms divided by the square of height in meters. Overweight is also 31 to 40, obese 40 plus, very obese. Consume food as per the body's need. Cardiovascular disease, community nutrition programs launched on the 1975 in pursuance of the National Policy for Children started in 33 experimental blocks, ICDS, Integrated Child Development Services. Now the goal is universalization of the ICDs throughout the country. Beneficiaries, children below 6 years, pregnant and lactating women, women in the age group of 15 to 44 years, adolescent girls in selected blocks. Vitamin A prophylaxis program 1970. Prophylaxis program. Ministry of HNFW component of the National Program for Control of Blindness 1968 to 1976. Single massive dose of oil preparation of vitamin A containing IU orally were given to all preschool children in community every 6 months through peripheral health workers. Prophylaxis against nutrition anemia. This program was launched by Government of India during 4th five-year plan, in which the iron and folic acid tablets were distributed to pregnant women and young children 1 to 12 years in MCS centers, and ICDs projects were implemented in this program. Scheme for adolescent girls, that is the Kishori Shakti Yojana. ICDs were launched by Department of Women and the Child Development, Ministry of Human Resources Development in 1991. It had targeted all the adolescent girls in the age group of 11 to 18 years. Kishori Shakti Yojana. Common services were the training for minor ailments, deworming, immunization. Iron deficiency disorder program launched in the 1962. Main focus on the use of iodized salt, replacement of the common salt with iodized salt. Midday meal programs was also known as school lunch program, operating since 1961. The meal should supply at least 1/3 of the total energy requirement and half of the protein needed. The cost of meal should be reasonably low. The meal should be prepared easily in schools with proper hygiene. Balwadi nutrition program support to preschool children was started on the 1970 under Department of Social Welfare for children age group 3 to 6 years in rural area. Was implemented through Balwadis, in which food supplement should be 300 kcal and 10 grams of protein per child per day. National Program for Nutrition Support to Primary Education. On November 28, 2001, the Supreme Court of India made it mandatory for the state governments to provide cooked meal instead of dry rations. Emergency Feeding Program 2001. Selected state Odisha Emergency Feeding Programs, food-based interventions. Odisha. Village Grain Bank schemes. Okay, it's for the tribal affairs. Bead-based nutrition program, WBNP. SC, ST, OBC hostel for the Ministry of Consumer Food and Public. The residents of the hostels having 2/3 students belonging to are eligible to get 15 kg food grains per resident per month. Sampurna Gramin Yojana, the 50 lakh tons of food grains to be allotted to the state duties free of cost by Ministry of Rural Development sell on lowest price. Pulse Mission, Minimum Needs Program, Food Hygiene that prevent the microbial contamination of the food. And the CFTRI is the Central Food Technological Research Institute is then the Mysore. It is the role of has always been on the high pedestal in the areas of the human resources development and R&D partnership, cherished to the international linkages with the institution and the USA also Belgium. NIN National Institute of Nutrition. This is one of the oldest research centers in the India and the largest center under the Indian Council of Medical Research, located in the vicinity of Osmania University. The National Center for Laboratory and Animal Science to be integrated into the National Animal Resource Facility for Biomedical Research and the Food and the Drug and Toxicology Research Center. National Nutrition Monitoring Bureau are the other wings of the NIN. The FSI is the Food Safety and the Standards Authority of the India, co-chaired by Director of NIN, is an agency of the Ministry of Health and Family Welfare. Care formerly Cooperative for American Remittances or to Europe is a major international humanitarian agency delivering emergency relief and long-term international development projects. Founded in 1945, CARE is non-sectarian, impartial, and the non-governmental. It is one of the largest and the oldest humanitarian aid organizations focused on fighting global poverty. In 2016, CARE reported working in 94 countries, supported 962 poverty fighting projects and humanitarian aid projects. In India, government agency in the New Delhi under the Ministry of Women and the Children Development tasked with the promotion of voluntary external research, training and the documentation in the overall domain of women empowerment. NIPCCD, National Institute of Public Cooperation and Child Development. Maurice Pate Memorial Award for UNICEF in honor of its work in developing services for the children to develop measures for coordination of community, government, and voluntary action in social development. ICD's Integrated Child Development Services Program. It provides technical advice and consultancy to government and voluntary agencies in promoting and implementing policies and programs for child development and voluntary action. In addition, it collaborates with regional and international agencies, research institutions, universities.